Most people know that smoking damages the lungs and the heart. Far fewer connect a cigarette with loss of vision. If the eyes do not hurt, it is easy to assume that everything is fine. Yet changes in the retina, the natural lens, and the optic nerve can develop quietly for years. The question is not only whether smoke makes your eyes sting. The more important question is what happens inside the eye when tobacco smoke and nicotine repeatedly enter the body. Cigarette smoke contains many chemicals. Some irritate the surface of the eye directly, while others enter the bloodstream. Smoking increases oxidative stress, affects blood vessels, and can reduce the delivery of oxygen to tissues. The eye is especially sensitive to these changes. The retina works continuously and depends on a healthy blood supply. The natural lens also needs to remain clear for decades. When harmful exposure is repeated every day, the risk of several eye diseases gradually increases. The first condition to understand is cataract. A cataract is clouding of the natural lens inside the eye. Vision may begin to feel as if you are looking through a fogged window. Colors look duller, headlights cause more glare at night, and a new pair of glasses no longer restores the same clarity. According to the CDC, people who smoke are about 2 to 3 times more likely to develop cataracts than people who do not smoke. Smoking is not the only cause. Age, diabetes, eye injury, ultraviolet exposure, and some medicines can also matter. But smoking adds a risk factor that can be changed. The second major threat is age-related macular degeneration, or AMD. The macula is the central part of the retina, used for reading, recognizing faces, driving, and seeing fine details. When the macula is damaged, side vision may remain, but the center can become blurred or dark. Straight lines may begin to look wavy. The CDC reports that people who smoke have about twice the risk of developing AMD. Early AMD may have no obvious symptoms, which is why normal day-to-day vision does not always mean that the retina is healthy. A dilated eye examination can reveal changes before a person notices them. Why can central vision be affected? There is no single simple mechanism. Changes in circulation, chronic inflammation, and oxidative damage all play a role. Smoking can also harm the optic nerve. This does not mean that one cigarette immediately lowers visual acuity. The danger is cumulative. Small exposures are repeated for years and may combine with aging, high blood pressure, high cholesterol, diabetes, or family history. When several risk factors are present at the same time, prevention and regular examinations become even more important. There is also a faster effect that many people notice immediately. Tobacco smoke can disturb the conjunctiva and the tear film. The eyes may become red, itchy, watery, or unusually dry. Some people feel burning, a gritty sensation, eye fatigue, or temporary blur after long periods at a screen. Contact lenses may become less comfortable. Persistent redness should not be hidden with random redness relief drops. Those drops may make the eye look whiter for a short time without treating the cause. Repeated symptoms deserve an examination of the eye surface, eyelids, and tear film. Second-hand smoke should not be treated as harmless. A person may not smoke but still spend hours in a room or vehicle filled with smoke. Their eye surface is still exposed to irritants. Children, people with allergies or dry eye, and contact lens users may be especially uncomfortable. An open window or an extractor fan does not remove all exposure. The most reliable way to protect other people is to keep the home and car completely smoke-free. What about e-cigarettes and heated tobacco products? They should not automatically be described as safe for the eyes. Their aerosol can contain nicotine and other irritating substances, and evidence about long-term eye effects is still developing. If vaping is followed by redness, dryness, headache, or blurred vision, do not simply accept it as normal. tell your doctor exactly what product you use and how often. That information can be as relevant as your medication list and medical history. Smoking also matters before and after eye surgery. Every procedure depends on proper healing and careful post-operative care. Smoking affects blood vessels and tissue recovery, so the surgeon needs to know about it before the operation. Do not decide on your own that avoiding cigarettes for a few days is enough. The recommendation can differ according to the procedure, the condition of the eye surface, and your general health. If you are considering laser vision correction, cataract surgery, or another eye procedure, discuss smoking cessation during the consultation and follow the plan given by your doctor. Who should be especially careful about regular eye examinations? People over 30 or 50, long-term smokers, patients with diabetes, high blood pressure or high cholesterol, and anyone with a family history of AMD, glaucoma, or early cataract. A simple visual acuity check may not be enough. The eye doctor may dilate the pupils to examine the retina and optic nerve, look at the natural lens, measure eye pressure, and use OCT imaging when needed. The timing of follow-up should be based on the person's age, symptoms, and risk factors. Another common mistake is waiting until one eye becomes obviously worse. The brain can partly compensate for a difference between the two eyes, so a slow change may go unnoticed. It can be useful to cover each eye separately from time to time and compare the image. However, a home check is not a diagnosis. If lines look distorted in one eye, a new spot appears, or clarity changes noticeably, arrange an eye examination instead of waiting for the other eye to change. Some symptoms should not wait for a routine appointment. Seek urgent eye care for sudden loss of vision, a dark curtain across part of the visual field, a sudden increase in flushes or floaters, severe pain, intense redness with nausea, or a new distortion that makes straight lines look bent. These symptoms are not necessarily caused by smoking, but they can signal an urgent eye problem. Early assessment can make a major difference in protecting vision. The encouraging part is that quitting smoking is worthwhile at any age. It cannot promise to reverse a disease that is already present, but it may lower the risk of cataract and AMD and stop repeated exposure to tobacco-related harm. There is no eye drop, vitamin or detox product that cancels out cigarettes. The useful steps are more practical. Stop tobacco use, manage blood pressure, blood sugar and cholesterol, protect the eyes from ultraviolet light, eat a balanced diet, and attend eye examinations on time. If you smoke, be honest with your ophthalmologist. The doctor's role is not to judge you, but to assess risk accurately. If vision has become cloudy, straight lines look distorted, the eyes stay red, or contact lenses have become uncomfortable, do not assume that tiredness is the only cause. At Ko'z Nuri, a comprehensive examination can assess the natural lens, retina, optic nerve, and eye surface. First, we identify the cause. Then, we calmly discuss the right next step for you.